Good afternoon, respected dignitaries. My case is a 16-year-old male who presented with watering and discharge from the right eye for 5 months. He noticed a swelling on the medial side of the right eye, which is painless and gradually progressive in nature for the past 5 months. We did a careful external examination which revealed a non-tender firm swelling at the right side of the eye over the lacrimal sac area. Roplus was negative. Other anterior segment and posterior segment examination was all within normal limit. So with this, we came to a provisional diagnosis of a right-sided mucosal, started the patient on oral tetracycline and requested for a NCCT orbit. NCCT orbit revealed a hypodense lesion in the area of the right lacrimal sac extending to the NLD into the inferior meatus. And also, to our surprise, we found a heterogeneous mass lesion in the left alveolus with surrounding bone destruction. So a careful examination of the oral cavity revealed a swelling in the left oral cavity, but the patient had no history of hemolacria, no history of fever or cough or weight loss, loss of appetite, no history of immunosuppression, and no palpable lymph nodes. So is it a malignant lesion? With this, we did a fine needle aspiration cytology from the left upper alveolus, and the histopathology was suggestive of malignant small round cell tumor, and also a histopathology from the right nasal mass was suggestive of malignant small round cell tumor. Immunohistochemistry showed CD45 positive, CD20 positive, CD3 negative, TDT negative, and also BCL2 and BCL6 were positive, all of which was suggestive of Burkitt lymphoma. The PET CT scan showed increased uptake at the left maxillary sinus area, at the right lacrimal sac area, and also at the left pterygoid muscle. However, no intraorbital extension. CSF analysis, bone marrow aspiration showed no evidence of malignant cells. We referred the patient to the oncologist. He was treated with a reduction chemotherapy of cyclophosphamide, vincristine, prednisolone, followed by an induction chemotherapy. At the current visit to us, we can observe the mass lesion over the lacrimal sac area has resolved. Lesion in the heart palate has also resolved, and the patient only has complaints of watering and discharge from the right eye now. Coming to the discussion of my case, Burkitt's lymphoma is a highly aggressive B-cell non-Hodgkin lymphoma derived from the mature germinal or the post-germinal B cells, occurs due to rearrangement in the MIC oncogene, and it is the fastest growing human tumor with a doubling time of 24 to 48 hours. Less than 5% of the cases of non-Hodgkin lymphoma in adults, but accounts for over 40% in childhood. However, the survival is very good, over 90% in children and over 70% in adults. Normally present as a rapidly growing tumor with very quick dissemination, and therefore 70% are diagnosed at a very advanced age. The most common site is the ileocecal region in abdomen, followed by the head and neck, and present with tumor lysis syndrome. The histology has a characteristic starry sky appearance. They are positive for CD20, CD79A, CD10 and BCL6. However, generally negative for BCL2 and TDT. The mainstay of management is chemotherapy. Rituximab-based regimens have shown improved survival rates. A quick review of literature. A West African Journal of Medicine has studied 260 patients of Burkitt's lymphoma. 43 had orbital tumors, out of them 79% had unilateral tumors, 21% had bilateral. Few case studies had also been reported. First one is a 7-month-old male child who presented with a facial and periorbital swelling. MRI showed subperiosteal infiltrates in the facial bone, base of the skull, and frontal and temporal bones. Next is a 31-year-old female who presented with a painful proptosis in the right eye, came out to be a case of orbital Burkitt lymphoma. CT scan showed lesion on the medial rectus muscle. And the last one is a 24-year-old male with a very aggressive Burkitt lymphoma of the orbit, presented with a large fibril exophytic mass from the right orbit. Exenteration was performed and HPA was showed starry sky appearance. The take-home message from my presentation: orbital presentation of Burkitt lymphoma is very rare, and to the best of our knowledge, there is no current literature which reports a nasolacrimal involvement of Burkitt lymphoma. So we have to look beyond the ordinary. Burkitt lymphoma is mostly diagnosed late and in a very disseminated form, but timely diagnosis, timely referral to the oncologist and is very essential, as chemotherapy has very good results. Thank you for your attention.